Hi, Stuart Langston along with Dr. Kahn. He is the director of the ACE program here at Crestwood Medical Center. And we've learned so much today about different things that are affecting the elderly community in our area. As a matter of fact, you were so concerned once you came to Huntsville that you created the ACE program here at Crestwood. Tell us what ACE stands for and some of the things that you're doing to help the elderly community here in Huntsville.
Right. The ACE unit stands for Acute Care for Elders. And it is a concept that started at New York University, where they train the entire nursing staff how to take care of an older adult. When a patient is hospitalized, it is not only the pneumonia they come with, they get depression, they get confusion, constipation, they don't eat properly, and when they go back home, they are worse off after hospitalization than before. So the new concept is to train the entire hospital based on scientific evidence from New York University, how to take care of an older adult in the hospital. And the leaders of this program are mainly nurses, because the doctors are there only for about 10 minutes to see the patient, while the nurses are there for 24 hours. They communicate with the patient, they communicate with the family, they have a checklist to prevent any complications, to get them out of the bed on day one, get them physical therapy on day one, rather than wait until their mobility goes down. So the ACE unit takes proactive measures, preventive measures, to prevent complications from hospitalization.
Now I know that your passion not only is with the ACE program, but to also spread information, help people understand that there are services and things out there to improve the lives of elderly patients. One of those being one of these church-based programs that deals with balance and strength training.
Right. Well, what we did was, at the age of 65, 1 in 3 people fall each year. And that is the commonest cause for going to a nursing home. And at the age of 70, there is a 50% chance of falling. And in the past, we thought when you fall, you need to go to the emergency room, take an x-ray, make sure your bones are not broken, and then go back home. The question is, why did the patient fall? And so we created this fall prevention program called Balance for Life. It is a church-based, where it's free for patients, and it is not an exercise. These are movements to retrain the aging brain, the nerves, the inner ear, the joints, the tendons, and that helps to establish new centers in the brain. And it has shown by research that the incidence of fall is reduced by 70% if you do it 3 days a week for 1 hour. And there are different programs in 11 churches with nearly 1,000 people participating in the community. So we encourage them to understand this. We are opening what we call doors to elder care, where we should use scientific evidence and not harm the patients, but help them in this age group that are very vulnerable.
We certainly appreciate you taking a couple of minutes here to just give us an overview of what the ACE program is and some of the services that are available. If they want to find out more about ACE or the Balance program, what is the best way to find out about the ACE program?
Well, they can go to our website. It is a nonprofit, centerforaging.net, and they can call the First Baptist Church, which hosts the Balance program, and it's available on the web, and the classes and the dates are written there. And it's free, and you can go only whenever you want. And most of the people there are volunteers. They will help you. And the volunteer we have there for the last 6 years who greets you is 96 years old.
If you'd like to find out more, again, check out the website, and we'll have more information too as well at WDRM.com.